ಕರ್ನಾಟಕ ವಿಜ್ಞಾನ ಮತ್ತು ತಂತ್ರಜ್ಞಾನ ಅಕಾಡೆಮಿ ಕಡೆಯಿಂದ ಶುಭಾಶಯಗಳು. ಇವತ್ತಿನ ಉಪನ್ಯಾಸವನ್ನು ಪ್ರತಿಭಾನ್ವಿತ ಪ್ರಾಧ್ಯಾಪಕರಾದ ಡಾಕ್ಟರ್ ಪ್ರತಿಮಾ ಮೂರ್ತಿ ಅವರು ನಿಮ್ಹಾನ್ಸ್ ಬೆಂಗಳೂರಿನಲ್ಲಿದ್ದಾರೆ. ಅವ್ರ ಕಡೆಯಿಂದ ಇವತ್ತಿನ ಉಪನ್ಯಾಸ ಇರುತ್ತೆ. ಗುಡ್ ಮಾರ್ನಿಂಗ್ ಅಂಡ್ ಗ್ರೀಟಿಂಗ್ಸ್ ಟು everyone. We would like to welcome all of you to this special talk by Professor Pratima Murthy. We have with us Dr. Pratima Murthy, the speaker of today's session, member of the KSTA, Dr. Eknath, the CEO of the Academy, Dr. M. Ramesh, my colleagues from Academy, Mr. Umesh and others, and the audience. To all of you, a warm welcome. A special lecture by Dr. Pratima Murthy, who is the professor and head of the Department of Psychiatry in the well-known Institute of National Institute of Mental Health and Neurosciences, that is NIMHANS, Bengaluru. Dr. Murthy has over 3 decades of research and education experience in the field of psychiatry, specialization in addiction treatment, research on outcome, comorbidities, and then also into deeply involved in national treatment guidelines and international training. She is a pioneer with regard to human rights of mentally ill, and also she is interested in history of psychiatry, digital training, and training of young medical health professionals. So with all this rich background, Dr. Murthy is coming here for the talk of the KSTA. From the Academy, Madam, we are grateful to you that you accepted our request and the invitation. And now we have audience from all over. We request you for your talk on taking charge of your health, reducing life risk factors. Taking charge of your health, reducing life risk factors by Dr. Pratima Murthy. Over to Dr. Murthy. Madam.
Thank you very much, sir. First of all, let me say it's a pleasure to be amidst you. Professor Ayappan said coming over here. So it's actually very nice that digital technology has allowed me to come over there and actually talk to all of you. Although physically not present, it's very nice to connect with all of you. I'm just going to share my screen. Just give me a second. Okay, so what I'm going to talk to you about is addressing risk factors for non-communicable diseases and how you can take charge of your health. This is a very opportune time to be talking about this because I'm sure all of you will only be concerned about COVID-19 and its impact and how you can prevent COVID-19, how you can prevent the complications of COVID-19, which in some way is a communicable disease. So I'm going to shift gears to tell you about non-communicable diseases and how we can address the risk factors for non-communicable disease. So we must know that in India, we have the burden of both communicable as well as non-communicable diseases. So when I say communicable diseases, TB is the classical disease that we know about, which our country has been grappling with. Of course, now COVID is certainly the most important pandemic communicable disease that we're all dealing with. But just about 2 years ago, in the pre-COVID era, we were recognizing NCDs as the new epidemic. The WHO recognized it as a rising and new epidemic. And we talk about hypertension, heart disease, diabetes, cancer, and mental illnesses as the most important, and chronic lung diseases as well as the most important NCDs. We know that the NCD burden has now shifted to developing countries like India because our life expectancy has increased. And therefore, many of these are diseases of young adults, middle-aged adults, and older adults. And therefore, we need to pay a lot of attention to it. About 80% of deaths from non-communicable diseases occur in developing countries. And what is more worrisome is that 1 in 3 NCD deaths occurs below the age of 60. And you might have been reading on social media about a CEO who passed of a heart attack at the age of 44. And that's typically something that can occur to young people. So we really need to look closely at how we can deal with non-communicable diseases. And we know that for every 100 Indians, every 1,000 Indians, about 159 of them may have hypertension, quite a common NCD. About 100 of them may have a mental health problem. So we'll talk a little bit about mental health problems. We know that a small number of this 100% can have ischemic heart disease, and it's very important to identify it and take preventive steps to make sure it doesn't translate into a serious cardiac problem. 62.5 have diabetes, and overall about 28 lakh people have cancer. This is a bit dated. I'm sure as our population increases, the number of people with these problems will also increase. But the most important thing that we need to know is that behavioral factors such as tobacco, alcohol, unhealthy diet, inadequate exercise, and stress are the leading cause of deaths due to NCD. And these are all essentially preventable. And that's where you and I have a responsibility to see how we can take care of our own health so that we can, to the extent possible, prevent some of these disorders. And we'll see how we can do that. So we've actually been looking at training doctors, nurses, healthcare workers in trying to address these risk factors so that by 2030, or in fact by 2025, we can actually set targets for tobacco, alcohol consumption, for dietary activities, for proper diet, for physical activities, and to reduce stress. So we've been training the healthcare professionals to try and deal with the public and help them to address these, these risk factors. But it's equally important at the grassroots level for ourselves to try and see what is it that we can do to help ourselves. I've also been involved with a study, a collaborative study with the University of York, where our main approach there is really not to differentiate physical disorders and mental disorders, because physical disorders outcome is worse in people who have anxiety, depression, and other mental disorders. And for people with severe mental illnesses, they can have diabetes, they can have heart disease, which can also reduce their longevity. We have a tendency to compartmentalize physical and mental disorders. This approach is one such approach to try and look at these together in an integrated manner, to look at health in a holistic manner. The WHO defines health as not a state of infirmity, but as a state of complete physical, psychological, social, and spiritual well-being. So it's a holistic definition of health, and therefore it becomes very important not to compartmentalize it and to be able to look at the relationships between different aspects of our health. I love this quotation because I think it speaks a whole host and tells us how we can take charge. So genes load the gun, but lifestyle pulls the trigger. So all of us know that for many disorders, whether it's diabetes, whether it's cancer, whether it's lung disease, that we may all be biologically predisposed, and there is so much genomic research, epigenomic research, metabolic research. There's so many new advanced omics that have developed to look at risk factors for disease. So while we're inherently prone, is it possible, that we should not just blame our genes and say we are predisposed? We also know equally, on the other hand, that environment plays an important part. I work in the area of addictions, and there we say about 60% of the risk to addiction may be genetic, but equally about 40% is environmental. So even if you have the genes that predispose you to the condition, it does not mean that you must manifest that condition or experience the complications from that condition. And that's why it's very important to look at lifestyle. So what are these risk factors that we're talking about? It's any attribute, characteristic, or exposure of an individual which increases the likelihood of them developing a non-communicable disease. And these are factors that may influence risk throughout one's life course. So what we talk about now is a life course approach to illness. From the cradle to the grave or short of the grave, we talk about how different kind of risks can impact us in various stages of our life. And secondly, the importance of recognizing any attribute, characteristic, or exposure we may have, which can manifest the risk to develop or complicate a non-communicable disease. And therefore, we need to constantly see what are these risk factors and how can we reasonably control them. So there are certain non-modifiable factors, like for example, age. The older we get, the more prone we are likely to be because of certain degenerative changes that occur to be exposed to to develop various kinds of NCDs. Gender. So for example, we know that women until their menopause possibly have a cardioprotective effect from their hormones, which goes away once they develop menopause. So gender can be a very important factor as well. And thirdly, a genetic risk. As I said, it's been identified for a variety of diseases. And we know that if there are multiple members in a family who have heart disease, who have had a stroke when they're young, who had a heart attack when they're young, we need to be careful about the risk for such disorders. But equally, there is a long list of these modifiable risk factors, from lifestyle behaviors like tobacco and alcohol and other drug consumption to an unhealthy air around us, for example, indoor air pollution, which can be a risk factor, as well as physical inactivity, stress, and improper diet. I think a lot of people now are recognizing the importance of diet. But of course, what happens is they kind of do quite the opposite. They swing to the opposite of completely denying themselves a lot of foods, in a completely what's the word for it? In a completely unnecessary way of controlling their diets, both of which are problems. And we have in our country the problem of both malnutrition that we see in lakhs and lakhs of young people, young children. We also see obesity, and we know now that India is called the diabetic capital of the world because there is so much obesity increasing the risk for diabetes. And I'll tell you, I'll come back to that when I'm talking about obesity in a little bit more detail, about some of the risks that poses not just to NCDs, but also to communicable or infectious diseases. Anyway, coming back to the risk factors for NCDs, you'll see, I told you about the various risk factors. These are all like the leaves in the tree or the clusters of branches that you get. But if you see that they're all rooted in these unhealthy lifestyles, and of course, age, poverty, socioeconomic factors are great drivers of NCDs, illiteracy, and of course, certain occupations can make people more vulnerable to develop these disorders. The most important thing to understand is that very often risk factors cluster together. So, you rarely have one risk factor, invariably 2 or 3. And when things like poverty combine with tobacco, alcohol, and stress, you can imagine that there's going to be a much greater consequence of this in terms of the risk for NCDs. Why are risk factors worth looking at? So before you develop disease, it's worth looking at it because treating an NCD, is expensive. These are all chronic conditions. They're not like a fever or a temporary kind of a headache which goes away. They're there to stay, and therefore they're quite costly to treat. People don't know about risk factors and the fact that they can help themselves and really either postpone or prevent the disorder from occurring. All of us engage in unhealthy lifestyles. Moderation is not considered a bad word. Generally tend to either swing to one extreme or the other. So if you prevent it in the primary stages, you can actually prevent or offset it. Health education, constantly knowing about what might be right. But this is not easy because there is so much misinformation and confusion from the huge amounts of information we get now from various kinds of sources, that it's very, very difficult to decide what one should do and what one should not do. And therefore, we need a lot of public health interventions to help us to reduce the burden of NCDs and the costs of NCDs once they occur. It is very, very expensive, and particularly for people who have to spend out of pocket, it can actually mean a complete disorganization and disruption of a family because of the costs of treatment. So we would like the NCDs to be integrated into routine healthcare, the prevention of NCDs, by modifying our risk factors and helping us manage ourselves and leading to improvements in outcome. In fact, it has been shown that if you address these risk factors, people, for example, with high blood pressures, if they are careful about their risk factors, they can lower their need for treatment. And in fact, at some point, if they are in the mild ranges, they can possibly control their blood pressures merely by the way they handle their lifestyle. And those are very, very important lessons for us. So when do people change? So people go through various aspects or various levels of change whenever it comes to behavioral change. So one is that they are not considering change. We call this the stage of pre-contemplation. And all of us, as far as our illness goes, we say, a little bit of weight, okay, this is a sign of middle age, nothing needs to be done about it. Or, I'm stressed, my blood pressures have gone high, but that's all, I don't need to do anything about it. So this is the stage of pre-contemplation. The contemplation stage, there's some awareness that there is a problem and perhaps a desire for a behavioral change, but no specific kind of action is taken, but there is some degree of awareness. In the preparation stage is when people feel that, yes, I have to do something, my weight is going up, I need to take a walk, and that's the only way. I've heard that, that you have to walk for X number of minutes and therefore I'm going to do it. The action is actually implementing that change, and then maintenance is when you are continuously in that change. And so that's the entire area of change that people go through. And if you actually look at any aspect of our behavior, whether it's in terms of our lifestyle, whether it's in terms of our finances, these are things that all of us go through, whether in terms of our work and any kind of change expected. All of us go through these stages of change. Now, at any stage, what can happen is that we can have a relapse. We can go back to our old behaviors. Typical example is walking, and I've done that 100 times before. I decide that I must walk. I, after a lot of effort, make all the changes of going out between 7 and 7:30. But just one day when it gets disrupted, maybe because I was busy with something else, I had to attend an early meeting, going back to that cycle becomes very, very difficult. So it's very important to try and see how we can get ourselves into the action or maintenance stage of making changes. And we need a lot of support to be able to do that. Let me go to the specific risk factors that trouble all of us. Tobacco in our country, we know that tobacco, I think almost 287 million users of tobacco are there in the country. India is very, very high in terms of production of tobacco and consumption of tobacco. It's amongst the top 3 countries. And we know that we have a burden of both smoking as well as smokeless forms of tobacco. We know that tobacco has both smoking and smokeless forms have a lot of adverse effects on the body. A lot of young people do not understand that tobacco causes premature aging. It causes hair loss. It causes sexual dysfunction, which is very, very important for young people to know. And of course, among adults, it's one of the most important preventable causes for young strokes, for young heart attacks. We know it's associated with, it has 70, all tobacco products, especially smoke products, have almost 70 types of carcinogens and as many as 7,000 chemicals, which are extremely hazardous to health. And Again, we've actually seen perhaps an increase in smoking among women in our country. And of course, in terms of the epidemiology, most women in our country who use tobacco use the smokeless forms of tobacco. Men use both smoking as well as smokeless forms of tobacco. So it's a huge burden in our country. And it causes a lot of side effects. This year, the World No Tobacco theme is Commit to Quit. And therefore, there is a lot of public awareness about the dangers of tobacco use, especially in terms of cancer and lung disease. COVID has possibly brought a new spin on this whole thing, because we know there are a lot of studies which suggest that smoking as well as smokeless tobacco increases the risk to develop COVID, increases the complications from COVID, and people who die from COVID, there is an overrepresentation of people who use tobacco in that particular group. So we know that tobacco use is extremely dangerous in a variety of different conditions. We also know that there's help for tobacco use. We now have what is called an M cessation. And this is a program where you just give a missed call to this number 011-2290-1701. And you can actually get messages on why it is important for you to quit, how you can quit, and be supported directly through a quit attempt and followed up for 3 months, 6 months, 9 months, and a year to help you to quit tobacco. So this is a free service that the government of India has provided, and a lot of people actually don't know about this service. And for people who find it difficult to access healthcare providers or don't have the motivation to go and meet a healthcare provider, and people who have mild forms of tobacco addiction, this can be very, very good to actually get help. I mentioned tobacco addiction, and we know that many people want to give up tobacco, but they can't because tobacco contains nicotine, which is highly addictive. So they gradually increase the amount of tobacco they use, and when they stop tobacco, they get unpleasant withdrawal symptoms. And because of these unpleasant withdrawal symptoms, they tend to use more tobacco. A lot of people start using tobacco, whether in the smoking or the smokeless forms, to deal with stress because of peer pressure, whatever it is, the habit takes over the tobacco use and people find it difficult. The important thing to understand about tobacco cessation is that the withdrawal symptoms are maximum in the first few hours and days after stopping tobacco, and that gradually these withdrawal symptoms, particularly the craving, subside over time. So one of the best things that people can do for themselves is to actually not initiate tobacco use for whatever reason, learn to deal with stress differently, learn to experience relaxation in a safer manner. But if they do use tobacco, to stop it as early as possible and perhaps take the help of programs like M cessation to give up. There is also the National Tobacco Quitline Service, and you'll see that the number is 1-800-11-2356, where if a person wants to talk to a tobacco counselor, they can call this number. And there are counselors who give counseling in the language of the patient. So it's available in multiple Indian languages, and the person can be helped with the counselor to actually give up tobacco. There are also tobacco cessation clinics. Many doctors and dentists are also trained in providing tobacco cessation support. For people who have severe addictions, in addition to the counseling, there is also pharmacotherapy that is available in the form of either nicotine replacement therapy. I'm sure all of you have seen advertisement for nicotine gums, nicotine patches. These are the nicotine replacement treatments. There are also non-nicotine pharmacological treatments that are available, which can help people to overcome their addiction. Although it is best to give it up as early as possible, even in people who have developed diseases, it is very important to quit tobacco because they can still prevent a lot of risks from occurring if they do stop the tobacco. So one of the ways we help people is to try and make a balance sheet about the good things about tobacco use and the not so good things about tobacco use. One of the things that people ask is, what good can there be out of tobacco? So only a tobacco user possibly knows that there are temporarily some relief that a person gets whether it's relief of anxiety, whether it's for a relaxation, whether it's to feel good, to be in company of friends. That's where people start. But when they know the not so good things about tobacco use, that motivates them to change from the pre-contemplation to the contemplation stage. And when they know that when they give up, there is more to be gained than lost, there is a motivation to give it up. And of course, when they know how to address the fears, what will I do when I feel lonely, when I feel angry, when I feel frustrated? If I have other mechanisms to kind of help myself, then I don't need to go to the tobacco use. So for these users, it's very important for themselves to try and make up this little balance sheet, like you do for your finances. Why do you save money? Because you would like to have A, B, C, of course, good health if you need help. The same way, we need to invest, like we invest in the bank balances, we need to invest in our health. And one of the investments we can make is by really deciding whether a particular lifestyle factor is useful for us or is risky for us, and how to modify that. So one of the positive things to help you to leave tobacco is what they say about positive thinking and thinking like a non-smoker or a non-tobacco user, and saying, finding other ways of handling the underlying situation without using tobacco, keeping in mind the negative consequences of tobacco, keeping reminders why people quit. So a lot of people quit for their health, particularly at the time of COVID. They're worried about getting COVID. They're worried about cough. They're equally worried about lockdown, and they're using tobacco in front of their children. So very often children and significant others can be motivating factors for people to change their habits. They also need to change old routines. For example, early morning constipation is a big problem, and very many tobacco users use tobacco early in the morning to ward off constipation. Therefore, they need to be able to change their dietary patterns, make sure they get enough fluids, possibly learn ways of relaxing, meditation, yoga, any kind of deep breathing exercise to help them to calm down. And of course, take pride in a person's ability to change and be proud of their decision, and for getting support from others to help them in sticking to that decision. The challenges that people may face, as I said, in the morning, it's a very difficult time. After food, people are very used to using tobacco, and they need to make sure they break the habit. And after a tiring day, or wanting to relax when they are exhausted, those are times when they need to have other things to do apart from tobacco being available to them. And this is therefore simple strategies as to how people with tobacco use, particularly milder forms of tobacco use addiction, can help themselves. For more severely addicted people, reaching out for help and support is very important. So these are some of the simple skills that people can use when their friends offer them tobacco. And I'm sure that these things can be learned and developed over time. The most important thing is to manage stress. I will talk about managing stress later on in the stress component, but it's very important for people who use tobacco or alcohol to be aware of how they can deal with stress. Let me move on to alcohol use. Lot of myths about alcohol, and unfortunately both tobacco and alcohol, especially so alcohol, have become very normalized in society. So we believe, and there are lots of people who believe that, especially when they have a cold and cough, alcohol is a wonderful thing. It just produces a sense of warmth because of the widening of the blood vessels, and that can be wrongly interpreted as relief from the cold. Using alcohol or tobacco to relieve body pains, we know that it's just a temporary feeling that is produced in the brain and not really addressing the cause for the aches and pains. We know that alcohol can actually cause neuromyopathy when it's used regularly. So people don't understand that the consequences are worse than these kind of things. People sometimes use alcohol to enhance sexual performances. We know that it may increase the desire, but actually impairs erectile functioning. Similarly, the ability of alcohol to think sharply, it's again because it produces a sense of well-being, but it can also equally cause an impairment in judgment. Similarly, that alcohol improves work performance, but in the long run, we know accidents, absenteeism, and poor work performance is typically characteristic of people who are regular drinkers. Why is alcohol not a good thing to induce sleep? Because it disrupts the natural sleep-wake cycle, and leaves the person drowsy the following day. Alcohol is what is called a REM suppressant. And when you stop alcohol, there is what is called a REM rebound with a very, very disturbed sleep. And of course, this classic example that in the army, people are given alcohol rations, because they can keep themselves warm. And that's something that the armed forces are also now trying to correct, because, we understand that, all alcohol problems start out of occasional use of alcohol and can lead to a lot of problems. So it is said that almost 1 in 2 people can have a problem associated with alcohol during their lifetime. And this is big. A lot of people also talk about the cardioprotective effects of a small amount of alcohol every day. Let me say that the American Heart Association has gone on record to say, please do not recommend any dose of alcohol as being safe. And in countries like ours, we have not found that J-shaped curve. We find a linear association between alcohol use and healthcare problems. So there are many other ways in which one can protect one's heart, especially through exercise and through diet. And one should not be using alcohol for that kind of cardioprotective effect. As you know, from head to toe, alcohol is also associated with more than 60 disease conditions. And therefore, especially when people combine alcohol and tobacco, it's a double whammy, exposing them to a lot of diseases. Unfortunately, by the time people seek healthcare, a lot of the diseases have already set in. And just like tobacco, alcohol is addictive. They both act on the reward centers of the brain. They release dopamine, which makes the person feel a little good. But over time, what happens is that the person develops tolerance to the effects of dopamine, and therefore the person needs to use more and more. Once it becomes a habit, it no longer has the positive effects for which it was used. People start to drink or smoke to relieve themselves of the negative effects of withdrawal. And that's the way the whole addiction cycle sets in. It is now recognized that even moderate amounts of alcohol consumption can be detrimental to certain aspects of health. And more and more people therefore need to understand that alcohol is really not necessary. And if it is used at all, people have to be extremely careful of the risks that they have to develop problems with alcohol. We move on to a diet, and all of us know that a healthy diet should have bodybuilding food, should have protective foods, should have fiber foods, and should have energy-giving foods. And these all should be balanced in a person's diet. We're all aware that what we need as toddlers is very different from what we need when we are much older. That toddlers or younger people need more energy-building foods, protein and muscle mass building foods, as well as protective foods. We know that gender-wise, women in their reproductive age need a lot of a balanced diet, particularly in protein. And the older we get, we also know that we need foods rich in fiber. So it's very important to understand what kind of foods we need. As I mentioned earlier, our country, we have the problems of undernutrition as well as disorders from increased weight. Undernutrition is very well known to produce poor development, poor growth, reduced fertility, reduced immunity, and greater instances of both physical as well as mental illness. And there probably is a transgenerational effect of undernutrition as well. Overnutrition can also be associated with diabetes, hypertension, heart disease, polycystic ovarian disease, several arthropathies, risks of cancer, as well as impairment of cholesterol, leading to a variety of other conditions. I'm not going to go into too much of the details about diet because this does not allow me to, and I'm not an expert on dietary issues. But nevertheless, diet and stress have a close relationship with each other. Some people, when they're stressed, eat very little. Some people, when they're stressed, eat very more. Some people, when they're stressed, try to eat and drink very, food which are junk foods, or drink colas, which are also problematic. Diet is also associated as a relationship with alcohol and tobacco, because tobacco can impair appetite, and as can alcohol. And this, when they are both combined, can cause an increased risk for NCD. Similarly, physical activity, people who drink too much, don't have enough physical activity, their muscle mass reduces, and therefore it makes them more vulnerable to NCDs. So what is our definition of being underweight or obese? Underweight is defined as being less than 18.5 in terms of the body mass index. Obesity is greater than 30 on the body mass index. People who are normal have BMIs of between 18.5 to 24.9. They just need to carry on with a healthy diet. People who are overweight need to definitely be cautious and, if necessary, get counseling about diet. People who are obese have to be extremely careful. And again, now, I keep bringing in COVID into our conversation because obesity and diabetes have been well known to increase the complications from COVID and perhaps also be associated with a higher mortality. And that's why it's very, very important to take weight very, very seriously and try and make sure that one follows a dietary regimen properly. Here is a list of food items that are generally thought to be healthy, but of course, while one puts up a green list, if one has disease conditions like diabetes, one must be careful even within these lists. But generally, a diet which is more rich in fruit and vegetables, in whole grains and pulses, having adequate fluids which are nourishing, and if they are non-vegetarian, preference to white meat rather than red meat, having nuts in the diet, having adequate water are all very important for the diet. And of course, foods that are avoided, we know that colas, fried foods, pickles, all Indian foods which are high in salt are things that need to be taken in moderation. And especially in certain disease conditions, they might be avoided. So this is a very generic kind of indication of what is healthy and what is not healthy. Depending upon one's underlying condition, these lists may have to be further modified. Coming to physical activity, we know that all of us are either couch potatoes or we are extremely athletic. So there is usually a range in between of physical activity, where there's physical inactivity, people who are, all the time, lazy, physically lazy people, and people who are working in sedentary jobs. And particularly now during COVID times, because of lockdown, because of working from home, many people are stuck to their chairs all the time, have very little mobility, and and can be at risk for NCDs. So insufficient physical activity, can be very short-lived activity. Moderate physical activity like brisk walking or climbing, gardening, dancing, walking short distances, cycling, weight training, because that's also very important. It's not just mobile physical activity, but also isometric physical activity. Yogasanas can be a good form of moderate physical activity. And of course, vigorous physical activity like jogging, cycling, swimming, brisk walking, vigorous weightlifting, and competitive sports can all be vigorous forms of physical activity. But we have a lot of barriers to physical activity, and typically COVID has produced the biggest barrier, because you can't go out walking, you can't go to the gym because gyms are not open. And therefore, now we have barriers in terms of COVID restrictions, but even at non-COVID times, lack of motivation to exercise, lack of confidence in actually, being able to go out of the house. And that's a big problem for many people. Finding exercise itself a boring routine, not having the right kind of spaces, fear of injury, especially people who've been hurt, may find it very difficult to resume exercises. And of course, I think we all sometimes need external motivations for exercise. Therefore, we need to help ourselves by making some time, by figuring out what is the best exercise for us, by being physically active at home as well. There are so many home chores that you can do, so many innovations that you can do to make sure different parts of your body are exercised. Finding company to exercise. So, group of family members doing yoga or, doing some physical form of exercise can be very, very important. And a simple strategy that we always advise is use the stairs instead of the lift whenever you can. So these are all little things that we can do to make sure that we get adequate exercise every day. The last part of my discussion or presentation is on stress. Stress is something that is almost ubiquitous. It's in the air. But we also know that there is something called positive stress and negative stress. A certain amount of stress is very important for all of us. It motivates us to do what we are doing and get better at what we are doing. Stress becomes negative when it results in a lack of productivity, when it produces so much pressure that it makes us unhappy and dysfunctional. So I think it's very important to define, not just say we are stressed, but see whether this is optimal or too much that it gets in the way of our function. It is very well recognized that stress can affect practically every organ in our body, from the brain to worsening of diabetes, to enhancing atherosclerosis, possibly because stress can reduce our immunity. As I mentioned, the immune system. It can affect the eyes. It can cause various kinds of effects on the heart. It can affect the skin. It can affect the kidney. It can affect the joints. And it can affect, of course, the lungs. So stress and systemic physical problems are very closely related. And therefore, it's very important to be able to handle stress, not just because of the psychological problems that it produces. Now, during COVID times, one of the things that can happen is a huge amount of stress around health anxiety. And, misinterpreting symptoms of COVID, to what to do when one has COVID, what to do, in terms of if one is hospitalized, if family members are sick, and so on, can be huge things. And we expect that even post-COVID, the stress around both infections as well as non-communicable diseases will be on the rise. A typical example is when there is focus on bodily symptoms that can increase anxiety, can make the heartbeat faster, can cause shakiness of the hand, can also produce chest pains. And then the worrying thought, is my heart failing? Am I getting cancer? Is it going to kill me? And then what happens is repeated checking of symptoms, repeated asking for reassurance, stops going out, stops being able to work. And that in turn can increase anxiety. And what are the triggers for this kind of health anxiety? Having somebody who's ill in the family, having had a past experience of illness, seeing too much exposure to information on ill health from various aspects of media, long-term beliefs about one's health. All these can fuel health anxiety. And I thought it's very important to recognize health anxiety, particularly during times of the COVID pandemic, related not just to COVID, but also to non-communicable diseases, particularly cancer, diabetes, heart and lung diseases, as well as mental illness. So beyond NCDs, I thought I should present a little bit, have a slide on COVID-19, because COVID-19 has really disrupted us on our health completely. We know that even in the lockdown phase earlier, as well as in the second wave now, there are more people who experience anxiety, depression, stress, substance use. There is an increase in tobacco and alcohol use, particularly post-lockdown, when people had a lot of boredom, a lot of anxiety, and so on. Post-traumatic stress disorder, which is, having gone through maybe hospitalization, death, illness, and having experiences that bring back flashbacks of that particular illness, causing a lot of discomfort, sleep disturbances, avoidance of that particular stress, and so on. And of course, the worst experience can be if it pushes people into feeling helpless, hopeless, and suicidal, which is not unknown during times of pandemics. We also recognize that the pandemic can have itself neurological sequelae, lung sequelae, complications in terms of pregnancies, and of course, psychiatric complications, particularly that people can experience. There is what is described as long COVID. And while people need not get anxious, most people recover very well, they get resilient, but there will be the possibility of experiencing some of these. And indeed, if the infection has affected the heart or the lung, etc., one might be careful that these do not progress by making sure that one, both looks at their lifestyle, monitors their lifestyle, improves their lifestyle so that they are not at any further risk. Always remember, even if a disorder occurs, you can make sure that the disorder is not progressive by monitoring some of these lifestyle issues And that's why I think it's very, very important. Remember that health is a state of complete well-being, and there is no health without mental health. So I think I started off with the definition of what is health. I end with the definition of what is health. And let me also show a couple of slides which tells you that mental health is on a continuum where you are healthy. So a certain amount of emotional turbulence is normal for all of us. A certain amount of feeling under stress is very important for all of us. When there are stressful situations, we may experience nervousness, irritability, sadness, tiredness, sleep-related problems, and impaired socialization. But when it translates to persistent changes in our sleep, in our level of motivation, in our emotional states, in our performance, then we obviously need to be careful. And when it is severe and we are simply not able to manage it, we must reach out for help. So you'll see that there is a green zone of health, a reactive zone where things usually settle down with support, an orange zone where you have to be careful and monitor, talk to someone, get help, and a red zone where certainly immediate consultation and professional assistance is very important to gain both one's physical and mental health. I'll finally end with a slide on resilience and wellness, because I think all of us, most of us are reasonably well. We have to look after ourselves. We have to be not just physically healthy, we need to be emotionally healthy, socially healthy, occupationally healthy, of course, financially healthy, spiritually healthy, intellectually healthy, and environmentally healthy. So if we really look at improving health and wellness in all of these areas, then I think we can reasonably say that we can be resilient and adopt lifestyle factors which can prevent the onset, even if there is an onset of illness, because we are vulnerable. It can prevent the complications from such illness. So I've left you with some thoughts on how to address risk factors for non-communicable diseases, which are equally valid for many of the communicable disorders. And of course, to try and focus on being well, identify when the wellness is translating into distress, and when the distress is translating into a mental illness, and when to take help. Thank you very much for your patient hearing. I'd be happy to take any kind of experiential sharing or questions. I'll stop now. Thank you very much.
Thank you, madam. Thank you very much for this informative talk and very relevant to the prevalent conditions today. Thank you so much. We have also been joined by another KSTA member, Professor B.G. Mani. Welcome to him. Now, Professor Pratima Murthy has touched on all aspects of mental health and wellness. If there are questions, comments, kindly our request to the audience, please.
Sir, there are
Any questions?
no questions as of now, sir. There are no questions. We have requested participants to mention in the chat box or Q&A,
Yeah.
also that they can give signal so that we
Okay.
can unmute them. But as of now, no questions, sir.
Yeah. Colleagues, friends, participants, any questions to the esteemed speaker?
In fact, I would like people to share their experiences of how well they are able to look after themselves. I mean, I'm sure there's a lot of individual ways in people, how people look after themselves and their health and that of their loved ones. I think equally you can share experiences if you want. You don't have to ask questions alone.
Yeah. Thanks, madam. Yeah, any comments? Any expressions?
Madam,
At this
there is
stage?
one participant, Sneha Prabha. She would like to speak. I will unmute her now.
Yeah, please go ahead, Sneha Prabha.
Can you hear me?
Yes, we can.
Okay.
Yeah, please.
Yes. Say I am working for Presidency University. Of course, what I want to ask so many people, they will think that suppose you are falling mentally ill, maybe because of overstress, not the positive stress, and maybe due to negative stress, and we are supposed to take some medicines. So most of the people are worried that we'll addicted to that and we cannot come back. And these medicines, I don't know, Pratima ma'am, you'll remember Dr. Pooja Harsha Shetty. She's in Melbourne now, and I am mother of her. She worked with NIMHANS. Anyway, it's okay. So that's my question. Is it addiction to that?
Okay. Thank you, madam, for asking a very relevant question. Number one, everybody with negative stress does not need medication. So that's very important to understand, that if it is mild, if it is temporary, if it is something that the person can be supported, support is very, very important. And that's why I think all of us, I always say that, the mind is like a pressure cooker, and constantly we are, a lot of ideas are boiling in it, and emotional responses are occurring, and a lot of stress is generating a lot of steam. So we need to be able to let off that steam, and the best way to do it is by being able to talk about it. So I think the first of all, what all of us need to do is to create an environment where it's okay. Just like I say I have a headache, just like I say I have chest pain, one must be able to talk about one's feelings and emotions without any kind of judgment. So one wrong notion that people have is that I have to be in control of my mind 24/7, 365 days in a year. And that is not possible at all. And therefore, I think people need to understand it's okay not to feel good. And second thing is about support. So I think apart from support from our own friends, family members, etc., when you get professional support, the first thing that is done is counseling. Now, if this feeling of anxiety, etc., is overwhelming, if it's, as I mentioned, in that spectrum, if it is in the orange or the red phase, and the person is not amenable to getting calmer by just counseling, there are good medications that are available. Any mental health professional who is prescribing that medication, there are some medications which are non-addictive. There are a few medications which may be addictive. Usually the mental health professional will counsel the person about this risk. But most important is to understand that when a person is given medication, this medication is usually for a short period of time, depending upon the underlying condition, can help the person to be able to put into those, the self-help things that I spoke about. Because if the anxiety is beyond a particular threshold, the person is unable to help themselves. It's just like diabetes. When the sugar is completely out of control, a dietary modification is not enough. Like that, if anxiety or depression is beyond a particular threshold, it can easily be reverted back with the help of appropriate medication if necessary, and then the person can institute their self-help mechanisms. So I think it's wrong to blanketly say that all medications are addictive. They are not. All conditions do not need medications. Medications can be extremely useful when they are used appropriately, particularly in people who are extremely distressed, extremely agitated, extremely helpless, suicidal. At that time, emergency treatment is life-saving. So I think that's important for people to understand, not just to feel, hesitation about taking medication, but to talk to the healthcare provider about their concerns, so that if medications are going to help, they can, as I said, be life-saving and helpful.
One more question I'll ask. I just want to know whether suppose any mental disturbance happens, if they continue to take, and this COVID time, how it on the immunity or maybe COVID medication time. So can you relate that one, those who are taking COVID medications and those who are not, but COVID time?
Sure. Thank you. Again, a very important question that you're asking. So one of the things is, particularly during COVID times, if a person has had a serious psychological problem, we encourage that the person, a psychiatric problem, we encourage that the person does not stop their medication and continues it. Because the stress of COVID itself can be extremely overwhelming. In fact, just to tell you, some of the psychiatric medications have actually been in trials to actually see if they can improve COVID outcome, because they might have an effect on immunity, etc. But the third and most important thing is to tell the physician who is treating you if a person happens to be on any medication, because what we need to look at is drug interactions to make sure that it is safe to continue both. But just as a general principle, that there is no great worry, okay? But it's important to tell the physician and make sure that drug interactions are something that are looked at carefully.
Thank you. Thank you, ma'am.
Thank you.
Mr. Umesh, any more questions?
No, sir. No, sir. We can conclude, sir. Thank you, sir. Thank you, ma'am.
Thank you, madam. Thank you very much for being with us. As a fellow of the Karnataka Science Technology Academy, we are grateful that you are a member of the family, and thank you on this occasion. We have Dr. A.M. Ramesh, CEO of the Academy, with his words at this stage. Dr. Ramesh.
Good afternoon. I would like to thank Dr. Pratima Murthy Madam for a very informative and enlightening talk on taking charge of your health, reducing lifestyle and risk factors. Madam, you gave a very good overview of how to address risk factors for non-communicable diseases, especially mental health, and also how to manage alcohol and smoking addiction and stress management. We are very, very grateful to you, Madam, for your time and giving us a wonderful talk. Thank you very much.
Thank you, sir.
I would like to take this opportunity to thank our Honorable Chairman, Professor S. Ayyappan sir, for encouraging us in organizing this session and also guiding us. We are very grateful to you, sir. Thank you very much. I'm also thankful to our esteemed members of KSCA, Professor B.G. Mulimani sir and Dr. A.E. Eknath sir for joining this session. Many senior faculties have joined this webinar. I acknowledge the presence and thank them. Professor K.V. Basukumar, Professor P.M. Patil, Dr. Girija Shivkumar, Dr. Prabhu Sarangmat, Dr. Suprabha, Dr. Sneha Prabha, Dr. Ashok Reddy, Dr. Vijay Kumar, Ms. Dr. Jyoti, Dr. Sumaya, Dr. Akshata, Manohar Dadmi, Riaz Ahmad, Dahid, and Sanat Kumar, and all the young teaching faculty and students who have joined this program. Thank you very much. Tomorrow again we have two more important talks by NIMHANS experts. First by Dr. N. Gayatri Madam, Professor, Department of Neuropathology. She will be speaking on neuromuscular disorders, an overview at 11 a.m. Second talk will be by Chittaranjan Andrade, Senior Professor, Department of Clinical Psychopharmacology and Neurotoxicology, NIMHANS. He will be speaking on understanding electroconvulsive therapy. I request all of you to kindly join for tomorrow's talk also. As Madam has rightly mentioned, no health without mental health. I wish you all a great day. Thank you very much. Thank you very much, Madam. Thank you, sir.